Welcome back, tech heads and gadget gurus, to another episode of Tech Times Daily, where once again we're going to dive into the world of tech and everything related. I'm your host for today, Chris Short, and joining me as always is the ultimate tech head, Christian Tejadas. Christian, man, how's it going? What's up?
Good, good. Hey, Chris, how's everyone?
All right, good, brother. Hey, all right. So today I want to talk about it's not AI, believe it or not.
Oh, thank God.
It's not politics.
Oh, thank God. Times two.
It's not any pedo shit or pornographic or um it's not yeah, it's not Chat GPT. It's not this is maybe a new actually topic for us. I don't know that we've touched on this yet. Uh but Neuralink has received FDA clearance for a second brain implant procedure.
Hmm.
So yeah, they were approved by the FDA after successful implantation of the device in Nolan Arbol, who was the first patient to undergo the procedure. And now they're looking to do it again. The decision follows the company's efforts to address issues with electrode functionality that had limited the device's effectiveness in its initial human test subject. So basically, first go around, albeit successful, could have been better, is how I take this. Um, and this, of course, marks another stride in the advancement of brain-computer interface technology. And this is huge, right, on the just on the medical um, front. So, because they want to give it to people, with ALS or, spinal cord injuries or quadriplegia. Um, but yeah, so what do you think, man? Like we talk, like I said earlier, we talk about how AI is in our lives and um, but that's limited to devices.
Yeah.
This is literally becoming a part of our body.
Yeah, this is
So
just
what's your
basically
take on Neuralink, really?
like I think it's a good idea
Mm,
considering how very little advancements we've done when it comes to brain health
mm,
and neurosurgery, right? So, in a sense, it's needed really now to provide hope to quadriplegics. Like, what other options do they have?
right.
Like it might be a long shot at this point, but if they dump enough money on this and dump enough intellect and the resources that they have, I think it's a good idea. It's all
Right. Yeah,
logical.
I think it's what technological advancements are for, right? Like, yeah, it's life is easier, right? Because I can order food right straight to my door,
Yeah.
or I can follow a map on my phone to basically anywhere I want to go. Yeah, that makes everything convenient. But this is as life changing as those things are. This is the definition of life changing.
Yeah. It offers you and it opens up your world completely to other things.
Mm,
Especially if you were born that way and haven't experienced something such as being able to freely wander around
mhm.
with the free use of your body. Like this is something that could greatly help you. The only question would be is regarding the cost of this and who could avail it. I think that's a much bigger question that we have because one thing it is for the discovery, another thing is the of accessibility
Mm,
for everyone. Like
right.
something this advanced, I understand it's not gonna come cheap,
Yeah.
but then again, if it just picks and choose who is actually going to be servicing, I think that's an issue they still need to look into.
Yeah, I mean I agree. My concern, well, before we get into concerns, I kind of want to discuss the excitement for this. So apparently more than 1,000 people have already like volunteered, right? Like I want this. Um, and yeah, back to your point about the eventual cost. Um, I guess it all kind of maybe depends on how it gets labeled. Is this a medical device or is this, maybe your insurance could cover it for certain things like quadriplegia or yeah, ALS or even autism,
How
right?
yeah, how lenient are insurance companies in the US with regards to the brain?
Well, they're not lenient in regards to anything really. They're a bunch of
Yeah,
fucking crooks.
I think we could
Yeah,
probably remove them
yeah,
from the equation at this point.
right. But I mean, as far as like affordability, people pay insurance and some things are covered and medications and those type things. Um,
Yeah, early on right now, I think we could just speculate like this
mm,
will cost a lot, and those who have the means will probably avail of it. Like like I said, they don't have any other options besides this. No one is actually making any solutions to their problems, right?
right.
And I don't know if there was someone else, but for me, this is the first time I'm actually hearing someone offering this type of thing to actually alleviate something that's been haunting people, making them suffer for almost all their lives.
I mean, other than what Stephen Hawking hooked up for himself, there's really nothing like this.
Yeah, what he hooked up for himself is not basically easing any of his sufferings, just basically for
Mm,
communications.
yeah, yeah, very true. In the brain, it's interesting that first off, again, I know that, Elon is a very polarizing figure, um, mainly because he stepped out of his lane and, stepped into societal type things. But I mean, you got to
Yeah,
go hats off, man. Like, who else is thinking of this stuff? Not only, no, let me rephrase that. Not plenty of people think of this stuff. Who has the balls to like do it?
yeah,
This is the type of thing that now we look back, greatest inventions, right? You got the telephone, you got the light bulb, you got combustible engines, you got flight, the wheel, fire. This is right up there.
yeah. Pretty much just like people tend to think of geniuses as crazy ones, right?
Yeah,
And risk takers. This is a big risk,
this is huge.
and both on Elon Musk's side and the volunteers. In terms of volunteers, here's the thing: they have no other options again,
Right.
and this might be the only time they could probably avail of the service for free if it actually works.
Yeah, I mean it's a gamble, right? Well,
Like the alternative is just staying the same.
yes. Yeah, exactly. Yeah, exactly.
Are there any reports regarding the testing phase for this and when it will start?
It's supposed to start. Well, they're currently seeking in June, I think. Did I read this in June?
Hmm.
No, not next
It's
month.
around the
There's no way.
corner if it's June.
No, there's no way it's next month. I did read it. Yeah, it's in the article if you guys want to go check it out. Yeah, it's in there somewhere. I can't
Like in terms of
find it.
brain computer interface, computers pretty your brain is pretty much a computer, right?
It is the
So
ultimate.
the way it functions, but I think it's a bit more complex as there are different factors involved. For one, it's live flesh, right? It's biology.
Right. I think it's the one of the very few things known to man that can't be reverse engineered. You know what I mean?
Yeah.
We have almost synthetic everything nowadays. The brain, they're trying with AI and shit, but you see the issues. Like it's damn near impossible to replicate.
Like I guess they started with a 3D printed model back then, right?
Yeah.
Like the ones that they used to practice surgery on.
Hmm.
I guess if you were able to map an entire brain enough for students to actually practice on for
Hmm.
surgeries, I think they could probably map out neurons and how they interact with the body's functions and actually flip the switch again for them to actually walk or at least have a bit of movement in their limbs.
Right. This kind of this type of procedure for these individuals that are struggling with, these enormous obstacles in their lives, whether it be mobility or communication. Um, this kind of puts me in mind of like the right to try law, right?
Yeah,
You know
you
what I'm saying?
mentioned
Like,
that
yeah,
before.
yeah, it's where, terminally ill people and medical professionals and they've tried everything. Nothing's working. Again, terminally ill, you have the right to try a drug, even though it's maybe not yet approved, right? Still in trials or something. Um, I just feel that this type thing could, yeah, this could be an incredible. I find it hard sometimes to appreciate kind of the time that we're in because
Yeah,
we're kind of in it. You know what I'm saying? But this is one of those things, man, that in 100 years we're going to be like that shit revolutionized everything.
yeah.
Now, what about the people that don't need it, just want it? Is it going to be strange to be able to control your devices just with your thoughts? Is that the next evolution of humanity?
I think that one's just pretty much a luxury, right?
Yeah, just on a luxury basis, right? Let's say no matter the cost, right? People can do it, they will do it, they want to do it. I'm not 100% opposed to it. Of course, security and things like I don't want people hacking my brain. YouTube does that already. Instagram hacks
Twitter
my
does
brain.
that actually.
Right. You know what I'm saying? But this is legit, like somebody's in there pushing buttons and shit.
I guess it would be good for some people. Like if it could make their lives any more convenient. Like this is the type of thing for the guy or the girl who has everything.
Mm, 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 yeah. It's almost the same as Vision Pro, right?
Yeah.
And nobody
And
needs that shit. It's
basically
really
in this
expensive.
age of money being power, like I remember the story regarding what gift would you give to Superman,
Mm,
right? So scratch that. Either Superman or Batman. What do you give to the person who has everything?
yeah, Batman. Yeah, what'd you give Batman? Yeah, I don't know.
Something that hasn't been done before, like brain hacking and being able to control.
Bat
Basically, that's a superpower in itself.
you know what I would give Batman?
What?
That AI generated dead loved ones thing.
I thought you were gonna say his parents back.
That's yeah, that's what I mean. Yeah, like that's the best we can do.
Yeah. Sorry, Bruce.
Yeah, but I mean, is this I guess my question is, we're already very much, and I've said this on here before, we're already very much androids, right? Like we are integrated as humans, basically what an android is, right? It's half human, half machine. It may not be 50-50, but the machine plays a big part and it's almost always connected to us, whether working online, scrolling with your smartphone, like this would be, you know, is it good to where now this is not only because now, right, I still have to reach for my phone. I still have to open my laptop. I still have to turn on the TV. This would be just there all the time. I'm 100% connected all the time. It feels like the
Yeah.
beginning of a new race of people.
Yeah, I was supposed to actually pose this question to you tomorrow. I want to open a topic regarding, can the human race not survive now without technology?
I was asked this just earlier today in a discussion I had. Could I survive without internet? Um,
Like it feels normal if you think about it when we were young, when these things weren't actually available. But when all
yeah,
the things in your lives that revolve around you, like all of these things actually are actually dependent on technology for you to actually move through life much easier, or
So
at least survive?
when you
I don't think
say
so.
when you say technology, are you talking about things as simple as like direct deposit?
Like these things, like let's say
I mean,
GPS. Let's say GPS.
would I have to go to the office and pick up my check like before?
Yeah, that type of thing. Like my example would be GPS. Could you still go to where you want to go without a GPS?
Yeah, but it's going to take a lot longer to get there.
Right? You
Yeah.
can still do that, but you wouldn't
Yes.
choose to.
No, I don't want to.
Like that's my question. Can the human race still survive if we take away all these technologies?
Survive, yes. Survive happily. It's going
I
to be
think
like
people
because
would
we're
die of
addicted.
frustration, I guess.
We're addicted, right? We're addicted to technology as a society, as a race, basically, a human race. We're addicted to technology. It would take a few, I don't know if it weeks, maybe or months, or maybe even a year or so, but eventually we would detox.
Yeah,
You know, what would the shock of losing it, eventually it being gone would be the norm. So
yeah.
we would survive, but I'm sure murder rates would go up, crime rates would go up. Um,
Like if the gun wasn't actually invented, people would still find ways to kill each other.
yeah, I
Like
mean,
it just made
yeah,
it efficient.
yeah. I mean, what was it before? Like uh,
Bows and
poisons,
arrows,
bows and
even
arrows,
rocks, right? Sticks. Like
sticks. Yeah, they'll figure something out.
people will find ways to do stuff, like if it's
Yeah,
needed. Going back to the Elon Musk thing, like it's pretty ballsy of Mr. Musk to actually go through with this because he really needs to follow through for these patients because a lot of hearts will be broken if he actually fails.
true.
And the perception of him is not really good at this point. He needs a win.
Well, the first one is widely considered a success. So if he wants to build, right, he has to build on this.
Yeah.
He can't have a setback.
Yeah, but
And they
that's
want to
who
go
I
deep,
but the first one is who developed it is who I call Playboy Musk. This is humanitarian Musk we're talking about.
right?
Playboy Musk can pretty much get away with anything. How about humanitarian Musk?
Right. I see what you're saying. Yeah. Well, there's no stopping, I think, now because the first one been unsuccessful, or had there been some devastating results or something, something, that just is never going to bode well. Like, let's take, for example, nuclear power plants, right? We know how great nuclear energy is. It's so clean, but so dangerous. Like, that's the reason it's not a thing, really. Um, but if he nails this on the second go around, then Neuralink is a
Yeah.
part of our lives at this point.
And
It's here now.
and I guess a better byproduct of this would be other tech companies might actually follow suit and create develop a research of their own.
Right.
Provide a much cheaper alternative to this, be competitive. Like
Yeah, that's what I was going to say. Maybe, yeah, it doesn't necessarily have to be cheaper, but the competition needs to be there.
the competition would actually provide the deficit when it comes to the availability of it
Yeah,
for every class.
yeah.
Like it's not so it's not the technology is not going to be I think limited to Musk.
No, actually, I was listening a few years ago. I remember him saying, probably on Rogan, I imagine. But even with Tesla and what's the rocket? It's like the easiest fucking name. What is
SpaceX.
SpaceX? Um, he doesn't even he makes the patents available
Hmm.
soon after, because his point was once they get it and start figuring, we're already doing something else. So there's no reason to like take our knowledge and just kind of be like, this is our knowledge, no one else. He's like, no, go ahead, because we're working up here. We're here now. We're done here. You guys can
And
do what you want.
Musk doesn't
We're
have Musk doesn't have the problem of other CEOs or business owners. He pretty much picked up the baton from Steve Jobs when creating a cult. Like he
Mm.
will still get his money,
Oh, for yeah, 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 yeah,
regardless of
yeah,
the patent and such. Like
yeah.
there's a bunch of smartphones available in the market, bunch of brands, cheaper prices, much
Yeah.
better specs, but
Specs. Yeah.
people still gravitate towards Apple.
Yep.
So,
It's that name.
right. So I don't think he's that much worried regarding the patent. He'd be seen
Right.
as a hero if he's actually the first one to actually do this, and the others will just be following. Basically, this is just a flex for them at this point,
Yeah, for sure. Yeah. I mean, the guy was already playing chess with it, just with his thoughts.
right?
The
So
first patient. Yeah.
kudos to him.
Absolutely, man. This shit is great. And as someone who had a family member with mobility issues due to, an injury and young in her life, yeah, I watched her struggle with being active for a day
Yeah,
would would cause her to be in incredible pain for the next few days, right? It was a neck injury, a lot of nerves and stuff going on in there. Um, she developed restless leg syndrome. Um, she started to live kind of a sedentary lifestyle because it was just too painful to move around once she got older. And like, and I know that's not quadriplegic, it's not ALS, but this is also infancy of Neuralink, right? Had Neuralink been here 100 years ago, at this point, someone with RLS could probably get Neuralink, right? Like it would just help.
yeah, and
Um,
down the line with their research, I highly
mm,
doubt they would shy away from looking at cognitive disorders,
mm.
right? It might probably solve or at least ease the pains of those that have Alzheimer's and dementia.
I mean, if we're tweaking the brain,
Yeah,
we're talking about controlling eating habits. We're talking about controlling depression, yeah,
quitting
uh,
smoking, like
quitting smoking, like addictions. This is all
yes,
in here. This is all mental. Everything that happens to us is mental. The pain that you feel when you prick your finger, your brain is telling you that that hurts. It's
yeah.
not your finger.
That's why we have different pain tolerance. My 10 could
Yeah,
just be 5 for you.
right, right, exactly. Yeah. So once you start to take over the brain, like he's basically hacking the strongest computer on Earth that's
Yeah.
ever been. As far as
Has there
evolution
been
and learning and all that stuff, he's hacked it.
so this has just been approved by the FDA. Have they shown a prototype regarding this one? Because they had one for Neuralink, right? The first
The,
one?
the first one, yeah. This one is kind of the same, but it's the
The software.
the software's been updated.
Yeah.
It addressed some issues from the first one. The I want to say probes. That's not what they're called. Yeah, basically, the wires are going to go deeper into the brain.
That sounds painful.
It sounds okay when they say deeper. I don't imagine that this is like this,
Like,
right?
no, I'm just kidding.
Yeah, but no. I think whenever I said deeper, in the picture in my mind was like wires in the brain, but it's very surface. I think
I think it's good to get a picture
compared,
of it for people to understand.
yeah, but I think it's great, man, and I just hope with the speed of technology advancement these days, I hope by the time I would like to see this reach not only its full medical potential, but its full application, applicable potential, right? Like I'm talking about, you know, doing schoolwork or, these things and recording dreams or whatever that the future may hold. Like I hope it happens. I'd like to see it. They got about 40 more years to make it happen.
Yeah, my main concern is actually just the availability. Like,
Yeah. Oh, they'll figure it out. I mean, look at Tesla. He made the electric car, which was once like a unicorn, right?
yeah,
Like
that's
people
why
never
I'm
going to work.
hoping for competition here because the only reason that those things are actually affordable now is because a lot of companies actually popped up with their own
Right,
versions of
right,
what
right,
he
right,
created.
right. But yeah, we'll see, man. It's exciting. We're gonna keep track of it here at Tech Times for sure. Once they select every time something comes out, any information comes from Neuralink, we'll definitely be on it over here at Tech Times.
See, we can do news without AI, just AI adjacent. So
Yeah. Well, just wait until AI is integrated into your Neuralink. Then what?
you won't have to think anymore.
You only have to think. It just
Uh,
it gets very sci-fi. But honestly, the world we live in now is sci-fi. It is. What do you call it when it's not sci-fi? Sci-fi?
science
Sci-fi?
facts?
Yeah, yeah, like,
I don't think
yeah.
there has been a movie regarding science facts, right? It's a hard sell. It's like just
Let's call it.
basically you watching a whale swim.
Yeah, it's a documentary.
A
Science fact.
documentary.
Yeah. 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 What's your favorite genre? Science fact. What is that? It's just documentaries. But
Sometimes
yeah,
there's a bit of embellishment even in those documentaries. So I don't still
true,
consider them as facts, right?
true, true.
They
As
have
a
to be
lover of
dramatic.
documentaries, yeah. But yeah, it's interesting, man. We're living in great times.
Yeah, give us more news like this, please. Like,
Yeah, this is incredibly interesting for
give
sure.
us more good news.
Yeah, yeah. But shit.
None of that PDF file thing. Please don't.
Yeah. Yeah. But all right, that wraps up today's edition of Tech Times Daily. Um, Tune in again tomorrow for more cutting edge updates and insightful discussions on the latest in technology. Until then, stay curious, stay connected. For Christian Tejedas, I'm Chris Short. See you next time.